just for the introduction, yeah. Okay, hi, my name is Mark. I'm from Mindful Music. The last RHoK event in December, we had a team working to visualise a music player for Alzheimer's patients. There's been lots of research recently showing the benefits of music to Alzheimer's patients. It can really improve their quality of life and the quality of life of the nurses and family around them. So yeah, back in December, we had a team that produced a prototype web-based that could help people access music. And this week, we've had a great team working on the sort of more hardware side, how we can actually access the music in terms of choosing tracks, rating tracks, changing the volume, things like that. So the team have come up with a great solution, and I'm going to pass you on to Benjie now, who's going to go through the details of what they've done.
So basically, music has a fantastic positive effect on Alzheimer's sufferers, and we want to be able to monitor that for research purposes and see how music can improve their lives. But the problem is that basically logging the mood data for the patients is quite an effort with the existing solution that's proposed, because it involves someone, for example, getting their phone out, logging into the site, choosing which patient it is, and then entering their mood. And we want to make it as quick and easy as possible so that we can get much more accurate data, and data much faster. Okay, next. So what we've worked on this weekend is effectively a hardware box. Here's our prototype. The idea is that it will sit in, there'll be a few of them in the patient's rooms within a residential home, for example, and they'll be able to just press a button on here to start playing the music. So we've turned it on. It's quite loud, so we can turn the volume down remotely like that. Can we load up the web page? And the idea is that then this will connect to a node within the room, which is currently running on a Raspberry Pi, and then just that bit. Yeah. And then basically the node will then connect to a hub such as this one, where users will be, the carers and the nurses will be able to monitor the different patients and what their status is. So you'll see if I'm a carer in Dave's room and Dave seems to be enjoying his music, I can press the happy button and you'll notice that it's changed here to say happy. If they're not so keen on that music, we can press the skip button and it will skip over to the next track, which is quite quiet. Unhappy, skip that one. And it will show that it's playing the day before. We can see what volume they're playing it at, and it just allows us to monitor stuff, to visualize stuff in real time. And this data, whether they're happy or sad with whatever tracks, and the time of day will be logged so that it can be analyzed for research purposes. Yeah, I think that's basically it.
So is that all? It's all self-contained on the Raspberry Pi?
Yeah, it's currently, there's remote nodes which run very, very basic, very cheap electronics. I mean, that node would probably cost about £1 to produce.
Okay.
We can run a number of those over, like this one's running over a long cable, which we can just route into different rooms within the rooms within the patient's home. And then there's a Raspberry Pi, one per patient effectively, that stores the music or can stream music from Spotify or other music sources. And then the nodes, one per patient, will then connect to a hub within the residential home or something like that, that allow that data to be aggregated and analysed.
And who did what? So there were, 4 of you. How did you guys, how did you break it up?
We had the designing of the box and the labels and such were done by one of us. The actual electronics were done by another. Then the coding to control the playing of the music were done by the other two of us. Yes.
Is this stuff you guys already familiar with, or a lot of new things you be doing, or well, did you learn a lot, or
Quite a few new
what's your
things.
takeaway from this?
Definitely ad hocing, no jazz.
Okay, in a good way.
Why listen to
In a way that worked in the end. So.
Internet is vital, is what we discovered this weekend.
And what's the plan to now?
Yeah, I think the plan is basically to continue working on this subject, on this project, affiliated with the local makerspace, so that we can try and get it into a residential home in Southampton for a test run, and see how that goes. And if it goes well, then maybe look at expanding it past there. We'll probably be 3D printing and stuff, the initial prototypes, to make a slightly better interface than a juice carton, which is what we have currently.
It might be worth mentioning the hearing aid, the induction loops and what kind of...
That's a good point. We're currently just playing the music out of the headphone socket on the Raspberry Pi, which connects to a speaker. But we're looking at the idea of either using wireless headphones, which is quite an easy and simple solution, or if the patient already has a hearing aid, we can possibly use the induction loop facility on that in order to send the music to them wirelessly with something they're already wearing, to simplify it further.
And the nodes themselves, something will be sitting in a room somewhere, or something mobile?
There's no reason that the nodes couldn't be mobile. They could quite easily be battery powered, very, very low current stuff, so it could definitely be made mobile. They're just currently wired because we had a weekend.